Okay, so I didn't frame these as closing comments. I was standing in line waiting for George to call on me as just a member of the pack. So they may not be quite as eloquent as what Mildred just said. But I guess my main impression is I join those that feel humble about what we've heard today. And I mean, again, we never really talked about creating a movement. We talked about what could we do, but even the what could we do part. But you know, the one, Ray, I was quite taken actually by Marshall Gantz's statement about the moral authority that those of us in medical care and public health and in these healing activities have. And so you know, maybe that cuts a little bit against some of that. So that's sort of kind of the mood in which I leave this conversation, aside from being totally, my brain scrambled with all this stuff. But the comments I was going to make up at front are these. Our health system, health, not healthcare, our health system is so badly performing in relation to other countries and in the disparities across our country. And I'm just so sick of these maps that I've been looking at my whole career, and actually they get worse rather than better. So there's stuff going on, like people say, and we need to honor that. But it's not up to it's not moving the maps. So, and what has to happen is that we've got to have changes in resource flows, substantial, sustained changes in resource flows, particularly in the direction of the social determinants, whether they come from Medicare waste or whether they come from some other unidentified category at this point. So, I mean, that's what we're up against. And David Williams earlier and Tony today told us, reminded us about how deeply rooted those disinvestment policies are. And so that is no mean task. It's a huge challenge, and I don't know if we're up to it, but that's what we're about if we're serious about our goal. Now, in terms of what the Roundtable should do, Mr. Co-Chair, I mean, I think, at least Roundtable, I think the way that you and we have laid out at least this next year's work on some of these drivers is the right way to go. As you may recall, I actually had a few reservations about getting to the movement first before we did some of the other pieces. So I think the work we have planned on goals and metrics and resources and communication strategies and the role of business and the role of education and community voices, I mean, that's what's on our plate for this coming year. Digging into those to begin to understand some of these pieces that everybody has said we have to have is a good thing to do, and perhaps return to this broader discussion at the end of that. So I think that's good. I join Jeff and others who believe that this is not something that public health liberals are going to do on their own. And I have been thinking about this for a while. And I think maybe what's missing from our agenda that I just listed is taking on this question of bipartisan values and a deeper understanding of what those different values are, because actually the colors of the map do correspond in large degree to political and other kinds of ideologies that we have to be sensitive to. I don't think improving health or reducing disparities has to be the partisan issue that other divisive social issues are. It shouldn't have to be, but we've got to find a way to I don't think we change people's values. I think we have to find a way to speak to them. Some of you may have seen, like 2 months ago, there was a great paper that came out in American Journal of Public Health. Two of our former Health and Society scholars, actually one of your PhD students, Sarah Gollist and Jeff Niederdeppy, they're communication researchers, and they asked the question, should the government be involved in programs to combat the obesity epidemic? And simplifying the results, the liberals said yes, and conservatives said no. When they inserted, so the paper was, when they inserted the phrase, should the government be involved in programs to combat obesity to improve our military readiness, the needle for conservatives swing almost over to the liberals. Now, I told this story at a Harvard scholar seminar last week, and one of the scholars said, well, that's a trick. Well, you know, it's not a trick. It's an understanding of a different thing that matters to a different group of people that can draw them into the same goal. So I myself am personally I've been thinking about this for a year. I have not been very productive. I am gonna devote myself to this next year, and maybe that's also something our roundtable can take on, because I think it does fit into our where we need to go to move this. So those are my comments. I also want to again thank the staff, Alina, and everybody else and the planning committee for pulling this together. It was an exciting, if not exhausting, day, and we will return to these things in February, at least in your roundtable, whenever your next roundtable is. And if there's nothing else, for roundtable members and staff and guests, there's a dinner down the hall at 6 o'clock. We have 45 minutes to mingle and do phone calls or whatever you need to do. So unless there is anything else, Alina, I can't see you. Is there anything else, logistics to mention? And both roundtables will reconvene here tomorrow morning at the time noted in your agenda. Thank you very much.
Thanks to the audience.
Thank you very much.